Normally, I always look at my pills before I take them. That morning, I did not.
Coming up today, a mix-up sent one woman into emergency surgery after she swallowed her hearing aid, where the battery got stuck and what else she swallowed besides her pills. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. What happened to the woman you're about to meet could happen to any of us. You wake up late, you're tired, you haven't had your coffee yet, and you make a freak mistake. But for Linda French, that mistake, along with the time it took to get answers, could have cost her her life. Alexis Del Cid shows us.
After 86 years on Earth, Linda French has her daily routines down pat. She takes her vitamins, pops in her gold hoop earrings, and then her trusty hearing aids.
They're pretty important to me, unless I want to say what, a lot.
And what she recently survived is a lesson to all of us who may be sleepy or distracted on any given day.
I overslept first, and I was really tired that morning. And since I overslept, I thought, well, I better take my pills. So I reached over, grabbed my pills, tossed them down, took a drink of water, and I thought, that's kind of scratchy. I don't have any big pills in my morning pills. So I look over and my pills are still there.
Her pills were still there, but one of her hearing aids was gone. She kept them in a container on her nightstand right next to her pill container.
I went to the emergency room and they took an x-ray, and she asked me if I had on a necklace, and I said no. She said, I think these are earrings.
Not only had Linda mistakenly swallowed one of her hearing aids, but also her earrings. At the hospital, not affiliated with the University of Kansas Health System, they used a scope to retrieve her earrings and told her she'd likely pass the hearing aid, which she did, but the tiny battery from the hearing aid had fallen out. She says the hospital sent her home and told her to come back in a couple of days. That's when a CAT scan finally revealed something startling.
The battery was in my appendix, which was very rare.
12 days later, and still waiting to hear how to treat her rare condition, Linda called her primary care doctor for advice. The doctor told her to go directly to the University of Kansas Health System Emergency Department. Once there, surgeons took her directly to the OR for an emergency appendectomy to get that battery out.
The battery did burn a hole in my appendix, but they got it out, so.
Linda says she's feeling great now, but moving forward, she's made a big change to where she keeps those hearing aids.
I keep them up on my dresser now. I'd have to get up and walk to get them if I wanted to swallow them.
And Linda French is joining us here in studio today, along with her surgeon, Dr. Jocelyn Hunter, and geriatric medicine specialist, Dr. Jessica Calendar-Rich. So welcome, ladies, today. Linda, did you have any pain after you swallowed the hearing aid and the earrings? You know, you felt it was weird going down, but was there any pain?
No.
What was the sensation like?
It was like a little scratchy, just right about here, but it wasn't painful at all.
Easy to miss, I guess, right? So yeah, we mentioned that you got the earring out with a scope. Were you awake for that procedure? What do you remember about that procedure?
They sedated me.
And what did they tell you was going to happen when they went in? That they were just going to pull it out?
They were just going to go in with a scope and they'd take them out.
And you'd have your jewelry back. Your jewels would be back. Are those them? Are you wearing them today? I love that. They've had quite the journey. So you spent more than a week knowing that a battery was inside you. How was that making you feel, just knowing that there was a foreign object lodged in there somewhere?
Well, I figured that someone would take care of it at some point. So I wasn't in pain. So I'm a pretty patient person.
You were waiting it out so you could get it out.
So yes, and I had 3 bowel preps that week when I was in St. Luke's South. And then they did a colonoscopy.
So Dr. Hunter, what's the danger of a battery staying inside your body? One thing to pass it out, but if it hangs around too long, what can happen?
Yeah, exactly. So the problem with batteries is when they become lodged somewhere or get stuck. So oftentimes in our pediatric patients, we'll see it lodged in their esophagus, and if it stays there, there can become a chemical reaction, which actually causes kind of burning of the tissue there. So if it passes through your stomach, that's okay, but Linda was much different because it got stuck in her appendix, which is a tiny little structure. And so theoretically, if it stayed there for a long period of time, it could have started to burn the tissue and make her appendix
So
burst open.
easy to miss because you usually would pass it. Is that correct? So it just kind of freakishly got stuck on its way, trying to make its way out.
Just kind of bad luck for Linda.
He said it was very rare.
Yeah.
Very
for it
rare.
to go there.
So were you concerned about how long it had been there? Did that have any bearing on how you were going to attack this?
I mean, in my mind, due to the risk of the burning of the tissue, it had to come out as soon as possible. And so we took her to the operating room the day after she was admitted and addressed the issue.
So you said burning of the tissue. What is the battery doing while it's stuck in there? How is it doing damage?
Now, full disclosure, I'm not a chemist or a physicist anymore, but I believe it's kind of the acids from your digestive tract cause a reaction with the electric component of the battery and can actually burn the tissue and break it
Well, and that
down.
doesn't surprise us. That's what we think about when we think of a battery doing its, chemical thing. So, Dr. Calendar-Rich, is this something that is common for people to reach over in the middle of the night, grab the wrong thing, and down the hatch?
I mean, I wouldn't say that swallowing the hearing aid and earrings is common, but swallowing the wrong pills, taking the wrong pills just generally can be really common. It's important for two people living in the home to keep those things really separated. Certainly we've seen many cases where people will take the wrong person's medicine.
Yeah, and you get in such a habit. You just, if it's there, you're going to grab it and probably not even think about it. It's like muscle memory for you. Is this limited to just seniors? Because I'm thinking I could see myself doing this.
No way. Haven't you ever played Yahtzee with your kid and put the dice in the wrong cup?
Yeah.
Right? Like throw it in a cup of water? Absolutely. It's muscle memory, right? Like we all just are doing the best we can.
So do doctors usually warn patients about the dangers of hearing aids and the batteries and how tiny they are? Because we've talked about this. We hear the stories about children swallowing them, but this is, an unusual story.
No.
You don't think you'd have to do that, but today we're doing it.
No, but now I think I will.
Well, exactly. That's it. It's a problem you didn't know you had to address, but now we do. Linda, how did you feel after your surgery? Any pain?
No, not really. Just a little bit in the recovery room, and then I was good.
So, okay, let's talk about changes you've made in your habits. Where do you store your hearing aids now?
My hearing aids are on the dresser across the room. My pills are still by my bedside.
Okay, did you normally just take, because I do that, I take my earrings out and I toss them down on the bedside table.
But I put my earrings and my hearing aids are on the dresser. I don't leave it because they were all in the same kind of containers.
Yeah, I could see.
Which is even worse.
Okay, so why did you have to take the entire appendix out? What other option would there have been, or is there no option?
Yeah, so the appendix isn't that big. It's kind of like a small worm-like structure hanging off the colon. So, if we opened it, it would cause contamination. So being an appendectomy being one of the more common surgical procedures we do, it seemed like the most straightforward option was just to remove the appendix, and luckily you don't need it for anything. So
let's follow the journey. So help us trace the path from the stomach to the appendix. It was rare that it got there, so how did it get there?
Sure, so your stomach connects to your small intestine, which then has a little valve before it connects to your large intestine. And so it got through that valve, but then got stuck in the first part of her colon, and it must have hung out there enough to just find its way into the appendix.
Was this a new one for you, a story that you'd heard?
First time I've ever seen it.
All right.
You're so lucky.
Yeah, you always
Right.
want to be different in medicine.
Be different, making history. So can you live a normal life without an appendix? What's its purpose? Kind of give us the biology lesson.
It's called a vestigial structure, so something that's left over from evolution that really is there just to cause problems and give general surgeons something to do in the middle of the night. Yeah, so no, Linda will be completely fine without her appendix going forward.
So could it have gotten stuck somewhere else? Or was it just the natural path? You swallow something, it passes through. Could it have wandered elsewhere?
Sure, I mean, you think about the narrowest openings or the narrowest structures, which is where things usually get stuck. So that's why larger batteries for kids in the esophagus, but they would have seen that on her endoscopy that they performed to get her earrings out. So there's not really any other narrow structures. I think, again, it was just the right place at the right time.
Just a kind of one of those freak accidents that happens. But again, now that we're hearing about it, hopefully we don't hear these stories very often. So Dr. Calendar-Rich, good reminder about storage. These are the conversations that you have to have with people, and just give us some kind of tips on proper medication storage and just kind of reversing that muscle memory a little bit so we don't get into some habits that get us into trouble?
Yeah, so first, I think it's important to highlight if you have children in the home or people living in the home that are cognitively impaired enough that they really are going to potentially take medicines or pills or think that they're candy. It's always important to lock those things up high where somebody can't reach them and where they can't accidentally be taken. Other things would be really, if you don't have those added challenges, just sort of putting things in a place that you're going to remember them, which I think Linda was doing really well by putting it at the bedside, but be in such a way that the muscle memory that you create can be as easy as possible and as fail-safe as possible. So whether that's like a medication box, right, that you set up at the beginning of the week, that helps a lot of people remember, yeah, I already took my medicines today, or no, I didn't. That's something even I struggle
Oh my gosh,
with,
I could take one, and literally a minute later I go, did I just take this, or was that yesterday?
Right, and so putting them in a box can really be helpful because you know, okay, Monday is empty, so I took Monday's medicines. That can be really beneficial. And then really making sure that we have the right medicines set out. I just will highlight yet again
and just you're tired, groggy, you take your pills before you get to the coffee pot, and you're in a rush. These are all just human factors, right?
And putting them putting them somewhere you remember them. So by the bedside work for Linda, a lot of people actually put them by the coffee pot because that's where they get their first drink.
Yes.
So.
Good tip. All right, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Information is right there on your screen. Let's check in with Dr. Dana Hockinson on this Friday. He's Medical Director of Infection Prevention and Control. I know I've seen you early in the mornings. You know, it's like 6 o'clock in the morning. If you have not had your coffee, do you ever get in a rush and kind of rush through some of the things you should remember in the morning?
No, I'm in a rush every morning, so I try to wake up and get ready real quick. So just my morning is a rush.
I know. So it's like, yeah, get that coffee routine going. So
I think more of the issue is when I do leave the house and remember something that I had forgotten, and I'm already halfway to work. So
yeah, that happens.
That's more of the issue than anything.
Happens, but it's Friday, so that's a good.
I know.
A good sign.
Yeah, I get to work on the weekend, so it'll be a really good weekend here.
All right, let's talk about the COVID count before we head into the weekend.
Yes, 12 active patients right now in the health system, and it was stable from last week. So hopefully this is a little plateau, and we can continue to see decreased numbers of people in the hospital.
So, Hock, you saw a new study published in the British Medical Journal looking at the risk of clots and heart issues after someone catches COVID, and it compared vaccinated people to unvaccinated people. So what did it find? Yeah,
that was the good thing about this study. So we know that COVID, the disease, can cause a higher risk of people having blood clots, especially in their lungs and in their legs. We also know it can have an increased risk on those people for heart events like heart attack or MI, but also stroke as well. So this was a very good study that was done. Again, it was the time period beginning January of 2021, so just as vaccines had been rolled out. They actually looked at 10 million people who were vaccinated, and they compared that to 10 million people who were unvaccinated. And then what they did was they looked at who had got COVID infection within 1 to 30 days, and then 30 to 90 days, or 31 to 90 days, and then 91 to 180 days, and looked at what is their risk of having those major complications that we can see with COVID. I know because when I was in the working and COVID was at its height, there were actually 2 or 3 people that had COVID a couple weeks ago, but had come in now because they were having trouble breathing. Turns out they had blood clots related to that. So they looked at these outcomes. They looked at heart attack, ischemic stroke, heart failure, and blood clots, for instance, in your lung or your legs. And what they found out was that people who got vaccinated actually had a lower risk of having those complications as well. And pretty substantial too. So within the first 30 days after vaccination, for things like heart failure, you had a 80% reduction in your chance of having heart failure after COVID. For things like ischemic stroke, heart attack, blood clots, they found that it was just over about 50% reduction in that risk for those complications. But those risk reductions also continued through up to a year, even though they were looking at their major time points was 90 to 180 days. They did follow these people out to a year. So the benefits of getting vaccinated and having a reduced risk of those complications continued through the year, even with COVID infection. So overall, again, we really want to be transparent, present all the up-to-date peer-reviewed articles. This is one of those that continues to tout the safety of vaccines and the positive benefits as well, reducing your risk of blood clots, heart attack, heart failure, and stroke. So get vaccinated.
All right.
We have our vaccine friend.
You have said it. 4 years running.
Yeah.
All right, Hawk, thanks so much. Well, let's get to some questions and comments from our viewers. I'm just going to kick it off. Alexis says, please tell Linda not to beat herself up too much. She said, years ago when I was a new mom and tired, I accidentally brushed my teeth with diaper cream one early morning. So it happens to the best of us. So if anyone watching has had some wacky mix-up, please share, because we've all been there. And on that note, Angela wants to know, this is something that some people, might not want to share. Why was it important that you shared your experience, as unusual as it was? Why did you want others to hear your story?
Well, my primary care doctor called me and said you had called him. And asked him.
Yeah, well, we had heard about your story, but did you have any hesitation about sharing it? No?
Not really.
Yeah, like we said, it's kind of fun.
It's kind of embarrassing, but.
Well, like we said, we've all done stuff like that,
right.
We all have
Not the dumbest thing I've ever done.
Right. I'm sure you're not the only one. Question or comment from Adrian. My mother's hearing aids do not have removable batteries. Instead, they have rechargeable ones. Do they pose a similar risk, JKR? Do you know if, from what you've heard maybe from some older patients?
A similar risk, like if they were swallowed?
Swallowed? Did they cause a problem inside? Just any other risk to
I think maybe Dr. Hunter knows better than me. My guess is yes. I mean, they have the same kind of conceptual battery makeup. It's just that they're being recharged rather than replaced.
Right. Anything to add on that?
Any foreign body in the GI tract is potentially a problem and needs treatment. So yeah, I'd say there's a potential risk.
How should you safely dispose of those little tiny batteries to avoid children or pets getting into them as well?
I mean, I think technically you're supposed to dispose of all of your batteries at a battery disposal location.
Are you saying if I didn't
do that? I'm not sure that anyone
what? You don't do that. I do it every single time.
So I would say, and I have a dog who likes to get into the garbage, so this is a great question. So, double bagging things that you're worried that somebody might get into, right? Putting them in another bag inside the garbage bag, or using locked garbage bags, garbage cans, things like that will help keep people out.
How does the urgency of this particular rare case compare to like a burst appendix? Any comparison to how you would tackle that if you saw a patient like this come in?
I'd say similar urgency. I mean, you want to address it as soon as it's safe and you have the resources to do so, because the longer you wait, the higher risk there is for complications.
So you say this is unusual, but what is the most unusual thing that maybe an emergency doctor has had to, that you can share, that you had to remove from someone? Maybe just from the stomach.
I would say this kind of tops the cake.
Really?
For interesting foreign objects that we've surgically removed.
What kind of surgeries do you do that are most common? What type of emergency surgeries do you do? We're just getting into, we just like to know what you're up to, Doc, during the days.
Yeah, so usually appendectomies would be the most common surgery that we do, but we do anything for holes in the intestines, hole in the colon, any perforations, anything like that. But luckily, Linda didn't get that far down the road. So.
Just curious, was it another question, was it a mistake for the other hospital to tell Linda to wait once they found out the battery was still inside her, or was it a natural thought for them to think that it would pass through?
Yeah, I can't really comment on the care necessarily at the other hospital because I'm not familiar with the case there, but I think sometimes with battery ingestion, it does pass through, from the stomach to the small intestine to the colon and goes out without getting stuck in the appendix. So I think this was a rare case. But I think once we knew it was in the appendix, then the decision was made.
And again, it's rare. So one hospital to another, just you wouldn't know.
Yeah.
So what would have happened possibly if she had not had that out, didn't know it was in there, just sits there?
Yeah, I think eventually it would have caused pain because of the reaction with the battery, and the intestinal fluid would have caused erosion, and it could have potentially burst her appendix.
Okay, Amelia says that she's heard that if your child swallows a battery, to have them eat honey. Is that true? Have you heard of this? I have not heard of that.
So I actually researched this coming into this, and it's something that is recommended nationally by the emergency medicine physicians to give them honey before they get to the hospital, with the thought that it could coat the battery and offer some sort of protection if it was lodged in the esophagus. But we don't do that once patients get to the hospital.
That would just be a quick fix if you're at home.
And like immediately after,
Yes,
it's
like
you see your kid swallow
honey
it,
hospital.
then give them honey. Not like, oh, I can't find the battery, maybe my kid swallowed it. That probably wouldn't be a reason to give them honey, because you don't know if it's still even in the esophagus at that point.
Got it. But it's an immediate thing if you see it happening in the moment. Before we get to
And if they, I'm sorry,
Oh, yeah.
are over 1 and old enough to have honey.
Right.
Because infants are not supposed to have honey.
Thank you for that tip.
Yes. The geriatrician just offered the tip about infants.
The tip of the day, the pediatric tip of the day. So thank you for that. We're going to wrap up this story, but before we let you go, I have to just kind of talk with our docs as we head into this time of year. Is there anything that, from a geriatric medicine standpoint, that people need to be aware of, that we should be thinking about? We're excited to get. We always talk to you as we go into these winter months, but as we get into the spring months, is there anything that we should be thinking about top of mind for ourselves or our loved ones?
Get outside.
Get out in the sun.
So we know that I always talk on this show about moving, right? Movement is medicine. We have to keep moving to keep moving. And now all of us that have been cooped up inside and haven't really had a way to get out and walk around, this is the time. But that also means watching how we're walking. Sidewalks are uneven, looking for places that haven't been maybe keyed up for the summer months related to gardening and things. Getting our stools out to do gardening and being really careful.
So just kind of,
knowing move.
Okay, just do it safely. Know your surroundings. Dr. Hunter, just anything we should keep top of mind so that we don't have to come in contact with you too often?
I agree with staying healthy, being active, staying hydrated, trying not to fall.
Okay, good to have you both here today. So I just want to talk about Linda. Just thank you so much for sharing your story. What do you want people to take away from what we've talked about today?
Well, so they don't make the same mistake I did.
Yeah, it's a simple mistake that happened in a moment, but hopefully you're the one and done case that we hear of that.
Well, I hope so.
Okay, Dr. Hunter, what's the takeaway from our discussion today?
Beware of batteries, but if something happens, we can help you. We can fix it.
Good to know. JKR, what's the big takeaway? Take us home on this Friday.
I mean, my big takeaway is just be mindful about how you're doing your setup, remembering you take your medicines, but only the medicines you're supposed to take.
All right.
And nothing else.
All right. Thank you to all of our guests today, and Linda for sharing your story. Thanks to our viewers. Have a great weekend. We'll see you back here on Monday. Coming up Monday on the Morning Medical Update.
This was not going to be just a matter of having some surgery and this goes away.
A breast cancer diagnosis couldn't shake Lisa Witherspoon's faith. I'm Jessica Lovell on the next Morning Medical Update. Hear why she wanted to avoid chemo at all costs, how she balanced her faith with hope and science. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcasts. Now, everywhere podcasts are available.